Hello, anatomy colleagues. This is Dr. Alsup, and in this short orientation video, I'm going to be going over the types of assessment that you will have in anatomy. Many of these you've seen before, will be in quizzes and final exams, and some will be new, so we'll talk a little bit about the ins and outs of the practical in this video. So let's go ahead and get started. In a typical block, so in anatomy's case, typical blocks are blocks 3, 4, and 5. We'll talk a little bit more about block 2 in a moment. So in these typical blocks here, there are going to be three main types of anatomy assessment. The first will be the readiness assignments. You'll actually have those in block 2 as well. You will also have questions from the quiz and the final exam. This will be true for blocks 3 through 5, and there will be an open book assignment in block 2. And then last but not least, there will be the always interesting practicals, which will be the last means of assessment for anatomy. Now, I had mentioned readiness assignments in the previous video as being a typical part of an anatomy session. So this should be completed after pre-work has been completed, but definitely before the session begins. These are due before 8 a.m. on session days. So key here is this is due before each session. And all students, all with a capital ALL, must complete the readiness assessment. So not just the dissecting team. So make sure that you pencil in whatever schedule you're using to organize your work, you pencil in that these readiness assignments are due before each anatomy session. Now, these are only worth 1 point, but they're relatively easy points, and you would not want to miss out on those kinds of points. There will be 4 questions for each assignment, and each question will be worth 0.25 points, or a quarter of a point each. And these are not participation points. You must get them correct to earn the point. But the good news is that these are going to be open resource and are meant to have you engage with material through an assessment format. And the questions will be derived from learning objective materials. You will have some identification questions on here, and this can all be found on Canvas. So just go to the assignments bar. You will also have anatomy-based questions on your quizzes and final exams. So if you have anatomy scheduled in a block, you can expect to have a few questions per session on the quizzes. That number varies based on the overall coverage. The number of questions on the final exam varies, but there will certainly be some questions on the final exam as well. So don't forget anatomy when you're studying for the final exam. These are multiple choice questions, and they are based on the learning objectives. And this is one of the number one questions we get asked. We save identification-based questions for the practical. Now, does that mean that you will have some images on quizzes or final exams from other disciplines or other lectures? Absolutely. You'll have images from radiology, etc. But in terms of anatomy-specific questions, we save those identification-based ones for the practical. Now, the only exception to having anatomy questions on quizzes and finals will be in block 2. And in block 2, to allow you to ease into anatomy and the types of questions we will have throughout the year, instead of there being questions on the quizzes and final exams, we will have questions that are similar to those types, but this will be through an assignment rather than in that higher stakes quiz or final exam. And these questions are going to be comparable to the learning objective practice questions you can find on the BlueLink website. And I'll show you those in a moment, but you can see there's an example here where you can see that we have a STEM, a question STEM. There's a little bit of a clinical correlation here, and then you have answer choices from there. And these are coming directly from the learning objectives. Now, as we move into systems-based blocks, many of the questions, say from a clinical lecture, they may include some anatomy. Anatomy is a really core concept. So do understand that many of these anatomy concepts will be throughout many types of questions, not just the ones written by anatomy specifically. All right, on to the big one, or maybe the one that you're least familiar with, and that's going to be the practicals. Practicals will be online. They are not in person, even though we do have dissection labs in person. This is being done for a multitude of reasons. Some include overtime exposure of the donors during what would need to be an extended time frame for practicals. Also, having the practicals online increases the flexibility for students regarding when they can take the exam and quite a few more. So again, practical exams are online, not in person. There will be one practical per block where there are anatomy sessions and will only cover structures from that block. So a structure covered in block 3 will not show up on the block 4 practical unless that structure was also discussed in block 4. The practical for block 2 will be graded for completion. This allows you to have exposure to what the practical looks like and allow you to assess your knowledge, but in a lower stress format as you're not earning a specific grade. But don't forget to take the practical. Occasionally we have students not realize I actually had to take it. You have to take the block 2 practical for completion to pass the block. It's just that you're not getting a specific grade there. The practicals for blocks 3, 4, and 5 will be graded, and they will be part of your overall block grade. And these are image-based, and these images are going to be anatomical donor images, and we will take thorough steps to ensure that the images we use in these assessments show extremely clearly the pertinent anatomical relationships we are testing. We do not like to trick. We want it to be obvious as to what we are pointing at and what we are asking, and that's always our goal. The images that will be on the practical are similar to BlueLink Atlas images, and if you don't know what that is yet, you'll become more familiar throughout the year, but they're not always the specific BlueLink images that you looked at to study. So again, these questions will be predominantly identification based. So for example, identify the muscle indicated by the arrow. So you will look at that arrow and you will tell us which muscle that is. So that's approximately 75% of the questions on the practical, give or take a few percentages. Now, the other 25% of the questions will be more application-based questions. So not only will you need to identify the structure indicated by the arrow, but then you will have to tell us something about it. So here are a few examples of the more second order type of questions. So which nerve traverses the foramen indicated by the arrow? So the arrow will be pointing at a hole, say in the skull, and you need to tell us what nerve will travel through it. And you will get that information from the labs as well as the learning objectives. Another example is which muscle attaches to the structure indicated by the arrow. So the arrow will be on a structure. In this case, it will likely be a bony structure. And you need to tell us what muscle attaches there. And then lastly, which nerve indicates or innervates the muscle indicated by the arrow. So the arrow will be on a muscle and you will need to know what nerve will innervate that muscle. Again, you'll get that information from the labs as well as through the learning objectives. The only structures you will be asked to identify, as in the only thing the arrows will be pointing at, will come from the list of structures. And this is kind of our contract to you regarding what we will ask you to be able to identify. So I would be very clear in terms of looking at the list of structures for each session. Occasionally on the images that we provide you, the BlueLink images, there'll be more structures tagged than on the list of structures. Feel free to learn those, but you will not be asked about those specific things on the practical unless it's on the list of structures, or you won't be asked to identify them unless it's on the list of structures. All right, this slide provides an example question with an embedded image. This is very, very similar to what you will see on the practical. So in this, we are asking you to identify the vein indicated by the arrow. And you see that there are multiple choices here: external jugular vein, inferior jugular vein, internal jugular vein, superior jugular vein. And one thing I want you to note is that all of the structures on this list are veins, or on these choices. So we only have veins as answer choices. That's similar to what we will do with other types of structures like arteries and nerves, as it can be really difficult to distinguish neurovasculature in both the labs and certainly in terms of images. So we don't try to trick you in that way. We're not throwing in an artery or a nerve here. We're asking you to identify which vein this is. So just for fun, the correct answer here is D, the superior thyroid vein. So this is the thyroid gland right here, and this is the vein that is traveling along the top or superior portion of the thyroid gland. So the name actually makes pretty good sense there. All right, we know you love practice questions, and we in anatomy love to provide you practice questions. So we have many, many supplementary resources where you can assess your knowledge and your readiness for your actual assessment. Again, these are not required. You'll see this on the web page. We have supplementary resources, but they may be useful in terms of your studying. So let's see if I can bring up some of this here. If we're looking at this particular web page, we're looking at the heart session. You will see over on the right-hand side, there will be a BlueLink cadaveric atlas. This is going to give you all the structures from the list of structures on that list, on the anything that would be required for you there. So nice for studying. But if you want to actually assess yourself, you would click on this page here. And this takes you to three different areas. The learning objective practice questions are similar to the types of questions that you may have on the quizzes as well as the final exam. So you will see this asks you a question. Once you guess, it will give you the answer as well as a explanation as to why that answer is correct, as well as the other answers why they're incorrect. So you'll have that rationale for each one. So that would be under the learning objective practice questions. We also have a quiz link, which is just basically that same BlueLink Atlas image, but it is click to reveal. So you would download this PDF in order to see that. And then last but not least, we have a practice practical. And these are actually a little bit harder than what the actual practical would be like. So you can, on this particular slide, it has an arrow pointing at a structure and asks you to identify the structure. But note that there is not multiple choice here. If you get this right, it's probably going to be quite a bit easier when you do have the multiple choice questions on the actual practical. So these are three of the main resources that you can utilize in order to see where you're at. Each session will have these three resources. So please take advantage of those as you work through. All right, excellent. So I want you to take some time to think through these different types of assessments. Obviously, as we get closer to practical time, we will send a refresher and more details in addition to reviewing some of the slightly different means of assessing in Block 2. But at least now you have an idea of what to expect throughout the entire first year of anatomy. Now, as always, I hope you feel free to reach out with any questions you may have, and thank you for your time and attention. Have a great day.